Hi, this is Southampton Town Supervisor Jay Schneiderman, and welcome to this special edition of Talk of the Town. In this show, we take a close look at issues affecting our community, and today we're going to talk about the one thing that everybody's talking about, and that is COVID-19, the coronavirus. And I'm joined today by Chief Skrzynecki. Normally, we would shake hands at this point, but we're practicing social distancing.
Yes.
So, Chief Skrzynecki, welcome to the show.
Thank you, sir.
I know you've been in law enforcement over 40 years, and we're certainly very happy to have you at the helm of our great police department at this moment in time. I imagine you've never seen anything quite like this, to have a pandemic that is fundamentally changing society, changing the economy, changing social interaction. So why don't we start with how is the police department affected? Is this something that is unlike anything you've ever seen?
Probably the only thing that even resembles this was the Ebola crisis several years ago, which was threatening us and never really took root. But there was preparation for that. That's the closest that I've personally experienced to what we're going through now. And this eclipses that tremendously, as we all know. So yeah, there's a lot of things that are happening within my department to address this, and a lot of things that we're doing in coordination with other departments and within the town and outside the town.
Talk a little bit about things happening within the police department related to the coronavirus. For instance, any kind of precautions your officers are taking in terms of wearing masks or gloves, how we're enforcing, if we're enforcing some of the restrictions on occupancies, whatever actions that are different because of coronavirus.
So the first thing that obviously we need to address is keeping our people safe. If we can't keep our police department safe and healthy, then we're not able to assist anybody else. So as soon as this started to break, we took a look at our protocols, we took a look at our personal equipment. We designed a Corona-19 package for every one of our primary cars, which consists of a garment to don, masks, glove, a mask for somebody who may be infected or suspected of being infected to put on that individual to try and curtail the spread from that person to our officers. So that's in every one of our cars, and we have protocols now that are listed and designed to be implemented to keep our officers safe if they have an encounter. In addition to those protocols, we are changing the way we do business slightly. So we're trying to, as everyone is, as you just mentioned, social distance. Even in our work, where we can, we're trying to social distance. So when we get a call for service now, certain questions will be asked of the caller. Do you have a fever? Do you have a cough? Have you been traveling? Are you on our already established quarantine list, which we get from the Department of Health? Those are critical pieces of information that need to be given to the responding officer, and that will dictate how the responding officer manages the call. If, for example, we're going out to assist somebody who is complaining they feel ill, and maybe they did travel, our officers are now given the phone number of that person calling in. When they arrive at the scene, because we have cell phones in every car, they'll call that individual, say, I'm outside the house. Do you need me immediately? Is there some urgency that I need to address? If not, I'll remain outside the house until EMS comes. When EMS comes, we'll talk about how we can assist this person and have as few people as possible enter and actually put hands on the individual. So it's all about trying to limit exposure.
When you say EMS, just so our audience understands, so like when an ambulance would show up,
yes,
or
emergency
a first
medical
response, a
support.
medical support person?
Exactly.
Okay, so that individual would know that they're going into a house with an individual that may be symptomatic.
Correct.
Of COVID-19.
Right.
In terms of those quarantines, is there anything you're doing? And I know there's different types of quarantines. There's people who actually have tested positive. There's also people who have had a close encounter in close proximity to somebody with who's tested positive. Are we doing anything to make sure that those individuals aren't wandering around the community?
Well, we're limited to what we can do, and we're even limited to the amount of information we get from the Department of Health. So the Department of Health has an obligation, and it's quite reasonable to understand, to advise our dispatchers so that our officers can have some forewarning, as I just mentioned, of what they're responding to. So we have the locations where we have quarantined individuals. Some of the quarantined individuals are mandated by the Department of Health. Others are just asked to self-quarantine because they report they may have been, as you said, they may have been in contact or had an encounter. So depending on that severity, it depends on our response. But in addition to that, we've just started, just actually today, a reach out program to the people, to the residences that we know are subject to a quarantine. We just want to make sure that they're okay, that their needs are met. So we're calling in, we're asking them, are you all right? Do you need any food products? Do you need any medications? Do you have somebody who is watching over you? This is doubling down on what the Department of Health is doing, recognizing the Department of Health is inundated now. Suffolk County numbers are increasing as numbers increase around the world. So there's limited accessibility to these people who are quarantined. So we want to be proactive, make sure they're okay, make sure that their needs are met. So we started doing that today.
Now we have, for a while we had no cases, but as of today, my understanding is there are 3 positive tests, 3 individuals who've tested positive within the town of Southampton.
There are 3 positive tests, and there are 3 that are also not positively tested, but we're monitoring.
Right, and of the 3 positive tests, I guess 2 are west of the canal, 1 is east of the canal. So this is, could be anywhere in the community. And, you know, we're mostly concerned about seniors and, you know, seniors being the more vulnerable population, a higher mortality rate with people, I think, above 70. It starts to go up the older you are. So the thinking in terms of the response to coronavirus has been to, you hear the blunt the curve or flatten the curve.
Right.
This idea that if we can have less cases through sort of extreme measures of social distancing and social isolation, that the hospitals will have an opportunity to prepare better. And that may mean more ICU beds, more ventilators, more, you know, training nursing staff and dealing with the daycare problems that some of the medical staff have with all the schools closed. Or whatever medical supplies that they would need, that they'd be able to prepare better for that if we could stall it, but also, you know, with the hope that a vaccine is around the corner, that maybe if we can keep as few seniors contracting COVID-19, maybe we'll be able to catch up on the medical side and the vaccine side, that we'll be able to get those individuals the vaccines so that they won't encounter it at all. So it's not easy to do, and that is requiring these very strict measures. I declared a state of emergency in the town. We shut down town hall to the public. We shut down community centers. We closed playgrounds. We kept parks open. We started delivering senior meals that normally they would come and they would congregate for. This has been evolving by the day, by the minute, in some cases. We keep getting different directions from federal government and state government. One of those state mandates was to close restaurants and bars to indoor dining, indoor activity. So now they can deliver. They can do takeout. I guess that's something that at night the police might have to enforce. I know we won't be heavy-handed on it, but I know that we are going to remind places. I'm not sure anybody's actually going to violate this, but if you're out on patrol and if you see people congregating inside of a restaurant, I'm sure that restaurant will be firmly notified that it's not permitted.
As you say, our first line there would be to remind them of this new ordinance, this new law. And we would be trying to just get compliance before we actually took heavy-handed steps. But if necessary, we would. There are laws on the books that support this. It would be a violation of law to disobey that. It's very important. You know, we're taking these steps for a reason. Not everybody agrees with it, but there's pretty sound logic behind this, all to the points you just made, to protect the most vulnerable people in our society. And there are things that I know you're doing, there's things that private businesses are doing now to try and protect those seniors, and the police department is trying to get involved in those things.
And we are urging people in the strongest of terms, particularly seniors, to stay at home. Stay at home, stay safe, and we're trying to figure out how to make sure they have their, their essential needs met. And it's not easy. I go, around town occasionally, and I see seniors at pharmacies, I see seniors at the grocery store, wherever it might be, and there is an increased risk just by being out and about. As you go through the cashier line, and the person before hands money to that cashier, and then you hand money to the cashier, then you get change back, and that the coronavirus can live on paper surfaces for quite an extended time, at least I think 24 hours. There's different studies that show different amounts of time. So we need to be really mindful. We need to wash our hands often, soap and water. Also, Purell or others hand sanitizers are good, not as good as actually soap and water. But the best thing seniors can do is stay at home. And we're trying to use this channel, Channel 22, to get information, local information out. But there's also lots of sources for state and county and federal information as well. So, and we're using our website to get information out. And we're actually looking at whether the town can help get seniors, all seniors, not just those that are income qualified, but all seniors, if we can help deliver some of the items that they might need. If somebody needs batteries for a hearing aid or for a smoke detector, maybe we can play a part in doing that. So we're looking at that. It's a big task. It's almost like a repurposing of local government to meet an emerging need. But I just had a meeting about that, trying to figure out how we could put the pieces in place to do that. And I know your department is out there. If somebody has obviously an emergency, I'm sure you'll do what you can to help. This is a challenging time, and I've never seen anything quite like it. We're doing everything that we can, but people really need to heed that advice, and for the most part, try to stay home because the more they interact, the higher their likelihood of spreading this. And it's not often about them. Younger people, this may not be that big of an issue for. But, the kid brings it home, gives it to the parent gives it to the grandparent, and the grandparent doesn't have the same type of immune system to handle it. So you've been participating in a lot of meetings. Are you speaking with other chiefs in Department of Health on this?
Yes, we are coordinated on the East End. There are 10 East End police chiefs representing the towns and villages on the East End. We're in constant contact. We're probably having a conference call twice a day right now. We're also very connected to Suffolk County Emergency Management and Suffolk County Department of Health. So we're coordinating our activities with all of those agencies, looking for best ideas. As you said, this is a very changing scene here. Everything is in flux. Literally by the hour, something comes up that needs to be addressed. It's a little out of the usual. So it's all about problem solving. It's what is the next problem that maybe we didn't see. The problem now becomes apparent to us. What's the best solution, and how do we execute that?
So my understanding is the county court administrator shut down the local courts.
That's just a good example of.
So what are you doing if you have a crime? Because obviously, although society is shutting down in many ways, the police
crime
department
doesn't stop.
goes on. So how are you doing arraignments?
That was just something that was addressed within the last 2 days and actually still being kind of shaped up. But right now, the county, with an effort to consolidate and try to limit exposure, all arraignments are taking place in Central Islip, so no arraignments are occurring in the respective village or town courts on the east end. So that, creates a big issue for us. If we have to take a prisoner all the way to Central Islip, that's a couple of police officers that have to go there. They're not in service here to protect our people. That's a big concern. But we've worked with the sheriffs, and we're working out a plan now where if we have to bring somebody to arraignment, we'll bring them to Riverhead, and the sheriffs will take that person from Riverhead to Central Islip, and we'll be able to return rather quickly back to our township. On weekends, our local court will be open for arraignments on Saturday and Sunday morning, as they always have. Appearance tickets are still being issued whenever we can. Appearance tickets are returnable to our local court, but our local court is then going to give an extension. We have a little bit of a mesh right now between the new Criminal Justice Reform Acts that we're obligated to oblige, which, as you know, have speed elements to it, so things have to be done within a certain period of time. So all of this gets rather complicated.
Is the state relaxing any of that, or not yet?
Not yet, no. We're still in compliance with that, and we're finding ways to manage it. It's just, these are complicators.
Isn't it interesting how just 2 weeks ago, the things that we were talking about, a lot of it was implementing that Criminal Justice Reform Act. We were, talking about various zoning changes to various hamlets. We're talking about water quality issues. We're ramping up for the busy tourist season, trying to figure out how we're going to staff our parks departments, and business seemed to be thriving.
Yeah.
And 2 weeks later, we're only talking about one thing. Yeah. It's COVID-19 and how to protect our population. The economy is going to take a hit from this. We've already seen it. I've had hotels tell me a lot of their international travelers, because they have no guarantee that they'll be able to come. So people who may have booked homes, let's say, for July and August, Europeans, or maybe hotel rooms, they're canceling left and right because they don't know they'll be able to get here. We have people who make their living off of tips who work at restaurants. We have retail stores that are not seeing the customers. The owners will, we have musicians who make their living performing at those restaurants. So we're gonna, a lot of people are going to be underemployed. Businesses will, still have to pay the rent. Our population will have to pay the rent or pay their mortgages. It's going to be really challenging when you know that so many people live paycheck to paycheck, and besides the personal challenges that our community will face and concerns about having enough to eat and all those things, there's also a relationship between poverty and crime. It's sad, but true. As people get desperate,
of course.
They will do what they need to survive. Is that something that you're thinking about, that our crime rates could increase as we get through this? And
yes, it is. And we've seen historically at times like this where the economy bottoms out, and as you mentioned, people become unemployed. Desperate people do desperate things. So we are now, and besides that, we have a lot of businesses that are going to be shut and unoccupied, and that's an invitation for a break-in. So we are ramping up our eyes and ears on businesses, and our nighttime patrols are really focused on those properties to try and secure those properties and make sure those properties stay secure and safe. We would ask, as you have been asking, the public to try and avoid a panic situation. I mean, it's so critical that we recognize that we will get through this. It's not going to be easy, but we will eventually get through this. And if everybody has a spirit of cooperation, it just helps so much. There's so much talk now about the psychological aspects of this, which come into play.
Yeah, children and adults. But worry about all these kids who are suddenly sent home from school, and not everybody has an equal home to shelter in. Some have more space than others, and that could be a problem too with overcrowding. But how does that kid feel when they see the playground is locked, right? Like what are they, it's just got to be scary to them. And I did close the town playgrounds. I think maybe some of the school playgrounds may be open, but what are some of the psychological impacts? And it's not just children. I have a teenage son and a 20-year-old daughter. Actually, 21-year-old daughter. She just it's interesting. She's the legal drinking age, but all the bars are closed.
Maybe to your benefit.
Yeah, maybe. In fact, I think the governor's order allows takeout alcoholic beverages. Do you know anything about that?
As long as they're in the original container. So an establishment that sells alcohol can sell a bottle of wine to you, for example, to take home, or even a bottle of whiskey. But you can't order a martini to go in a glass. So yes, you can get a meal, you can get it accompanied with a bottle of liquor or a bottle of beer. That can happen. You're just not allowed to pour you a drink.
Not an open container. Yeah.
No. And so far we haven't changed any of our local.
Yeah, but let's go back to talking about the psychology, and neither one of us, that's not, well, did you study psychology?
I did.
You
it was
did.
my
Major. That's interesting. Not criminal justice or
both?
both?
It was a criminal justice psych combination.
Okay.
Yeah.
Interesting background. That probably, I know you were you were a detective and head of detectives for a long time, and understanding psychology probably helped you
very much
get inside the mind of somebody who would commit an evil act. So
very helpful.
Yeah. So so as a psych major or minor, how do we help people get through this?
I think a very important thing for people to do, for our residents to do, is not get caught up in watching constant television reminders of this problem. I mean, you're home, and it's very easy to put on these news stations that are just 24/7 giving you bad and horrible story after story after story, and it can depress anybody. So you want to be informed, and you should be informed. We're doing that right now. But it's also very important to take a breath and get away from that. If you're not working, or if you're working from home, or if your children are at home, get outside in your yard, take a walk around your block, use some of the beautiful facilities. We're in one of the most beautiful places on earth. Take advantage of the outdoors.
Discover our beaches, our parks.
Absolutely.
And the parks are open, and we have great trails. We have some of the best trails anywhere.
Absolutely. And I find myself, and you probably do too, we're very involved. We're 24/7 involved right now. But even as I'm driving to work, even if I'm driving to my office, driving through the township on a back road, clears your mind. It reminds you that it's not all doom and gloom. We still are.
Right. No, we're definitely going to get through this.
Yes.
But we're all doing our part. And this sort of radical measures of social isolation it presents a lot of challenges, economic challenges, but also psychological challenges, as you say. And take a walk along the beach.
Absolutely.
Get some fresh air, get some exercise. I know a lot of the gyms have closed. SYS, which is a major facility, I know they closed for 2 weeks, but I don't know if they're planning on reopening. Not everybody has exercise equipment at home. Some do, but a lot don't. Please, go out and go for a walk.
And you want to try to maintain your health, right?
Yep.
I mean, we're faced with a health epidemic or pandemic. You want to try to maintain your health. That requires exercise. It requires good nutrition. So, you still want to practice these things.
And stress kills too. So
absolutely. And stress very much lowers your immune system.
Yeah. So lots of good reasons to get outside.
Absolutely.
Besides discovering some of the great places, we've been very active in preserving open space, and it's using our community preservation fund. We've preserved thousands of acres of open spaces, and we're fortunate to have that. A lot of people don't even know about it. I think if they go to the town's website, they could probably find links, maybe some trails maps and things like that, or numbers that they can call and maybe get some information about an interesting place to go see. Right. Unfortunately, a lot of the museums and things are also closing. I think Parish closed, which is a wonderful museum. But there may be some places that open. People have to go
And if
online.
you can't do that, maybe you tackle that project around your house that you've been putting off. Now you have some time to do it. Focus on it. Just get your focus off of this problem a little bit during each day is, I think, a good way to go.
I think that's great too. So we're going to get through it. It's going to be a challenge. There's so many things to think about, and the numbers for us are changing every day, and the directives are changing every day. We try to stay in contact. I know I talk almost every day with other supervisors and mayors, as well as the county health department, and we try to share information. They're talking about mobile test facilities and being able to, make an appointment. And I don't even know if that mobile test facility will come out to our area. There's some drive-through test facilities. One I think has been set up now, Jones Beach.
It's operational in Jones Beach.
And I think that's by appointment only, but
Correct.
They're talking about getting one of those in Suffolk County as well. The hospital, Southampton Hospital, we have also Peconic Bay and in Riverhead. I know they're doing their best to keep up. My understanding from Southampton is they seem to be managing okay so far with the current caseload, and they're prepared for more, but there may come a point where they get overwhelmed. I hope not, but it's likely that there'll be more cases of this. So our job, at least from my perspective, is to slow down that increase.
It shows that the measures we're taking seem to be working. Obviously, there is an increase, and it probably will continue to be. But if you look at the townships around Suffolk, our township is doing pretty well.
Yeah, it's interesting. On the North Fork, not so well,
Correct.
Comparatively. I think
Correct.
over 20 cases in the town of Southold.
Right.
I think largely in the Greenport area.
Yes.
I guess we're fortunate having but only 3. I'd rather have 0. I was concerned when the state brought 26 students returning from overseas.
As was I.
To the campus. But the updates I've been getting, and they've been frequent, is that there was a 14-day period where they were going to be monitored, and no students left, which was great, and no students became symptomatic.
Correct.
And they're running out that clock. They've got a few days more to go, but it seems like it's been positive. And the one case we had at Southampton Hospital being treated wasn't from the town of Southampton. It was the first case in Suffolk County, which was out in the Greenport area. I don't know. I think Southampton Hospital may be treating others now. There might be a couple cases. And I really don't know how many cases are at each hospital, but limited number of cases, at least in our area. East Hampton, 2, I believe, as of yesterday. There were 2 cases
I think that was the right
active,
number.
and they both were at the same dinner party. So, as we get more numbers, we'll share those numbers here on CTV. Anything else you want to say? Any other precautionary notes for the public before we go?
Well, the things, I won't repeat all the things that you've been talking about, the hygienic things that are so critically important, but people should be mindful of that. And clearly, I think one of the things that are allowing us to have the low numbers that we're seeing is that we're following these guidelines all the way through, whether it's your personal hygiene or your social distancing. We're following those recommendations, and if we continue to follow those recommendations, I'm hopeful and fairly confident that we'll remain one of the lower experiencing townships. And we have a nice advantage here of being spread out. There's not too many areas in our township where people are really on top of one another. So that's a great advantage that we should take advantage of. And I would just, once again, I'd ask everybody in our community to be not panic, to try and realize that there is a light at the end of the tunnel. We'll get there. Probably the worst thing people can do is get into a frantic feeling of despair and do things that would cause my department to have to take action. We want to support everything that the town government is doing. The police department is playing a role in just about every aspect of it. And we're going to continue to do that, and we're going to continue to keep our people safe through changing our policies as time goes on, equipping our people with what they need to have to make sure that they can be safe.
Now, if somebody has had direct contact with somebody who's tested positive, what should they do? Who should they call?
First and foremost, they should stay home. First and foremost, if that is the situation, do not go out and expose yourself to others. Call your doctor. If you're not
primary care, so
Yeah.
you're not calling the hospital per se in that situation.
Correct. Call your
Primary
doctor
care
and
physician.
say, I had an exposure. The likelihood is your doctor will tell you, okay, self-quarantine for a while. Just isolate yourself and see how this progresses. You may show no symptoms. You may not have contracted the virus. You may have been contaminated, but still may not show symptoms. So, you know, and as we
Right.
see in young people are sometimes able to tolerate this with little or no symptoms at all. So if you know you came in touch with somebody, the primary thing to do is isolate yourself, call your physician, be monitored by your physician. If your conditions worsen and you need hospital care, then make an arrangement to go to the hospital. Either call the hospital and say, I'd like to come in on your own, or call 911 and say, I have these symptoms and I think I should be
Now, in general, in terms of getting tested, you know, if you are symptomatic or if you're non-symptomatic, in general, they're not doing tests for people who are not symptomatic.
Simply not enough tests available.
Right. So if you are symptomatic, you have to meet, I think, certain symptoms. So I think it's a sore throat, fever, and a cough. I'm not sure what else that they're looking at, but you know, then I don't think they're suggesting that if you're symptomatic, you go to the hospital emergency room. I think it's still
Correct.
should be calling your primary care physician.
Right. Or if you can't get a hold of your primary care physician, which might be the case, call a hospital before you just show up at the hospital.
Right.
Or call the police if you need transportation, if you need emergency medical care. We'll get you to the hospital and we'll get you there safely.
When should somebody call 911?
Just call 911 if they have emergent care needs. So if you're really experiencing difficulty breathing, if your fever is really spiking high, call 911 and we'll get you to a hospital.
For non-emergencies, they can call the police. There's another number, right, that they can call for non-emergencies.
They can
Yeah.
call our general number for information. And they can
Right.
also call Town Hall for that information
For
as well.
information too. And now the county set up a sort of a hotline for lots of things, including COVID-19, 311.
Yes.
So not 911, but 311.
Non-emergency information number.
Right, and there is apparently a human being at the other end. It's not just a recorded message.
Yeah.
And somebody will help answer questions or direct them to other people who could answer those questions. I think that's really important. And you know, there's lots of sources of information. You know, we're trying to be one here on Channel 22, but you know, also the town website, the county's website, the CDC, the state. Everybody's putting up as much information as they can and trying to help people. So I guess, you know, I will repeat too that, you know, all that advice that we've been giving, to take it seriously, the frequent hand washing, the social distancing, but mostly stay safe and stay at home. And I'll add in, stay tuned to Channel 22 and all those other places I mentioned, so you can find out exactly what the changes are and what, you know, what things you need to know to help better protect yourself and your family. So we will get through this. It's not going to be easy. There's going to be health impacts and economic impacts and psychological impacts, as you said. But we will be here for you. We'll do the best job we can to try to make sure you have all the things that you need to be safe. So, Chief, thank you for all your hard work in running this police department, and thank you for coming on Talk of the Town. I'm not going to shake your hand. Social distancing.
Thank you.
But don't take it personally.
I won't.
All right. And thank you for watching this special edition of Talk of the Town. We'll see you soon.